In this video, we're gonna talk about vasculature found on the posterior abdominal cavity. Now, inside the posterior abdominal cavity, we have the inferior vena cava found on the right side of the vertebral column, and the abdominal aorta, which is located left to the inferior vena cava. Now, inferior vena cava is formed when left and right iliac veins join in front of the fifth lumbar vertebrae. And then inferior vena cava ascend along the right part of the vertebral column and penetrates the diaphragm through the inferior vena caval foramen and joins or empties to the right atrium of the heart. Inferior vena cava receives the renal veins. This is the right renal vein, which is shorter, and the left renal vein, which is longer, because the inferior vena cava is found on the right side of the vertebral column. Another feature here that we need to talk about in terms of relation of the left renal vein and the superior mesenteric artery. So the left renal vein runs between the superior mesenteric artery and the abdominal aorta. Another vessel that inferior vena cava receives is the right testicular or ovarian vein. So the right testicular vein directly drains into inferior vena cava. Again, inferior vena cava also receives the lumbar veins. Now let's look at the abdominal aorta. Abdominal aorta has unpaired branches which leave from abdominal aorta through its anterior surface. And from superior to the inferior, these unpaired branches are the coeliac trunk, which supplies to the organs that derive from the foregut, and superior mesenteric artery, which supplies to the organs deriving from the midgut. And this is the inferior mesenteric artery, which supplies to the organs deriving from the hindgut. And there are also paired arteries arising from the lateral surface of the abdominal aorta. These are the testicular artery in male or ovarian arteries in female. And lymphatic drainage of an organ always is to the origin of the arteries that supply an organ. So when we study lymphatic drainage of an organ, for example, testicles, their lymphatics drain to the lymph nodes that are found the origin of the artery that supplies, in this case, to the testicles. So lymphatics of the testicles drain the lymph nodes around the abdominal aorta. Now let's look at this one. This is the left renal vein. The left testicular vein drains into left renal vein. There are a couple of things that we need to talk about here. Now, the testicular varicocele in 90% of the cases occur on the left side because left testicular vein assumes a more vertical course. Another reason This left testicular vein is found or located behind the sigmoid colon. So the content of the sigmoid colon may apply pressure to this left testicular vein, and venous blood return becomes more difficult. Another factor that causes varicocele formation on the left side is that the left testicular vein drains in the left renal vein. Left renal vein has low negative pressure, low negative pressure compared to inferior vena cava. And look at here, abdominal aorta bifurcates in front of the fourth lumbar vertebrae. This is called aortic bifurcation, where abdominal aorta bifurcates in the right common iliac artery and left common iliac artery. Then each common iliac artery divides into an external iliac artery and internal iliac artery. Internal iliac artery supplies to the organs of the pelvic cavity and also the external genitalia, or the external genital organs or the structures. The external iliac artery supplies to the musculature and the bones of the lower extremities. Simply, external iliac artery supplies to the lower extremities. And also remember, this external iliac artery becomes the femoral artery inferior to the inguinal ligament. Now let's look at the primary retroperitoneal structures here. So if the peritoneum is here, the space behind the peritoneum is called retroperitoneal space. The organs inside the retroperitoneal space is called primarily retroperitoneal organs. Primarily retroperitoneal organs include kidneys, suprarenal glands, inferior vena cava, abdominal aorta, the stems of the abdominal aorta, the branches, let's put it this way, origins of the branches of the abdominal aorta, branches of the inferior vena cava, including renal veins. These are all primarily retroperitoneal structures. And also abdominal part of the ureters are also retroperitoneal. In addition to these structures, thoracic duct, which is not shown here, thoracic duct, and sympathetic trunk, they are also primarily retroperitoneal structures. What you see here is the psoas major muscle. This is the iliacus muscle. Iliacus and psoas major muscle together form the iliopsoas muscle. Iliopsoas muscle flex or bend the lower extremities. If we stabilize our lower extremities, then these muscles can flex the upper half of the body or our body.